Decriminalizing possession of small amounts of fentanyl, cocaine, methamphetamines. Yes, that's right. It is a Canadian first. British Columbia has been given the exemption from the federal government to tackle the opioid crisis in a new and to many a very controversial way. As of the end of January next year, Canadians in BC aged 18 and older will not be charged if they possess a combined 2.5 grams of illicit drugs. Just remember, selling and trafficking of those drugs is still illegal. But 6 years ago, the province declared a public health emergency due to the significant rise in opioid-related overdose deaths. Advocates say the dramatic policy shift will help treat addiction as a health issue rather than as a criminal one. Meantime, the NDP leader, Jagmeet Singh, is saying, you know what? We should make this a national approach to drug decriminalization. Check it out.
What does that say about the rest of Canada? What does that say to the thousands of families who buried their children because they were lost to a toxic supply or to an overdose situation? What does it say to the rest of Canadians that their lives don't matter? It's shameful, frankly, to not take a national approach to a national crisis.
So, should the federal government decriminalize possession of certain drugs across the entire country? And what progress do BC health officials hope to see from all this? Let's find out. Joining me now is British Columbia's Minister of Mental Health and Addictions, Sheila Malcolmson. Minister, good to have you on the program. I know BC had called for this for a long time. They wanted the exemption from the Controlled Substances Act. You got it for 3 years. Why was this so important?
We've been throwing everything at the overdose crisis since it was declared a public health emergency 6 years ago, building up new treatment beds. We went from one supervised consumption site when we formed government to over 40 now. A lot of them are inhalation sites because people consume drugs in different ways. We're the first province to offer prescribed safe supply. We've given nurses the ability to prescribe medication-assisted treatment, and still toxicity of the illicit street supply has outpaced our ability to add new services and interrupt that connection to illicit drugs.
Yeah, BC saw 2,224 suspected toxic illicit drug overdose deaths in 2021, more than 9,400 since 2016. These are tragic numbers. I guess the question is, and I know you have the support of the Canadian Association of Chiefs of Police, the BC Association of Police, a lot of people support it. But there's a lot of people that say this is counterintuitive, that decriminalizing fentanyl, decriminalizing cocaine, these small amounts of it, is the wrong way to go. What do you say to the folks that say this is literally the wrong path?
So really important to clarify, we're decriminalizing the people who use drugs. We're not legalizing or decriminalizing the drugs themselves. They remain illegal. Trafficking remains illegal. Even below the 2.5 gram limit, if there's evidence of trafficking, it's trafficking and charges apply. But we hear, the people that the coroner tells us are dying of overdose, the majority are dying alone in their own homes with their family and friends having no idea that they were struggling with addiction. And these are people that never reached out for a treatment bed or medication-assisted treatment. So, and even though police have, by and large, not lately been charging people for small personal possession, there is still a major stigma about it. You might lose your job, you might lose your ability to travel. And if you were thinking of bringing your illicit drugs into a testing center to find out about their toxicity, you're not protected from criminal charges. Right. So all kinds of ways that stigma has driven.
So you're saying, police will not. Why is it important for police if they see someone with 2.5 grams of fentanyl, they won't take the drugs from them anymore? Why is that so important? What would happen in the past if they did take the drugs, if they seized them?
This is what we heard from public health and from people who use drugs, who are part of our core planning table, who built our application, is that when people who are medically dependent on illicit drug supply have that taken away from them, and it's after hours and the medical clinic is closed, they are going to make themselves more vulnerable again and do desperate things, petty crime, more dangerous sex work. So this is a really important part of the framework. and a big departure, you're right.
Well, Alberta Premier Jason Kenney says as a neighboring province, the government of Alberta is alarmed by this announcement to decriminalize. We'll be monitoring the situation closely. I want to state in the strongest possible terms the government of Canada and the government of British Columbia that Alberta will exhaust all options should their actions cause damage to Albertans. What is your response to Premier Kenney?
Well, Premier Kenney's record on responding to the overdose crisis and standing up healthcare supports is pretty clear, and a marked contrast to what British Columbia is doing. But this is an exemption that we sought for British Columbia, and I can't imagine how this would impact what's happening to our neighboring province.
Well, I mean, Jagmeet Singh is now saying they should nationalize this. There should be a national decriminalization program. Does BC agree with that?
In summer 2020, Premier Horgan wrote to the Prime Minister saying, this is advice I'm getting for here at home, and I think that you, Prime Minister, should look at a national decriminalization framework. It would be better for us to look at this in coordination. That didn't happen, and so we made our own application last November.
Minister, will Canadians and people in British Columbia, how will they know if this is working? You've got 3 years here. Is there a number that you say we expect the overdose deaths to fall by X number? Or is this in conjunction with stopping the toxic supply? In other words, how do we know if this is actually a good solution or not?
The work that's easier for us to measure is how many more addiction treatment beds we're able to stand up, how quickly we're able to chip away at the waiting list for them, how many more people we are able to connect with medication-assisted treatment, prescribe safe supply, how many more visits we have to supervised consumption sites and testing centers. That's all much more measurable. Decriminalization of people who use drugs and combating that stigma is much more of it's a real sea change in thinking. It's a change in the way that we're balancing public health and the more traditional justice.
I understand that, but what about cracking down on the dealers, cracking down on those people that are supplying basically the poison?
Yeah, very fair. And that's work that my colleague, Public Safety Minister Mike Farnworth, is seized with. That's work that's happening all the time. We're trying to make those seizures as high profile as we can so that people know that we're tackling that side on the input. And then also doing the work where, again, in my area of responsibility as minister,
right,
where people are already dependent, connecting them with prescribed safe supply as a way to separate them from the illicit street supply.
Well, BC gets the exemption. We hear other jurisdictions across this country are applying for the exemption. We'll find out if that happens. But BC's Minister of Mental Health and Addiction, Sheila Malcolmson, after your government has long called for this, you got that exemption. So here we go as of January. Thank you.
Thanks, Anna.